He had a fall at home. They thought it was a stroke because he fell and broke his shoulder and cut his tongue. Initially, it was thought that it was just that was it. It was a stroke, and that he would recover from it. But he was behaving strangely, and we kept pressing on that. And he had X-rays, and it was discovered then there was a brain tumor, and it was category 4, and it was inoperable. Although the staff did their very best, they didn't really understand, and that Keith had lots of friends, and they couldn't understand why there was always lots and lots of people coming, and lots of flowers, and they couldn't cope with the flowers. And in the end, it was a Macmillan nurse who saved the situation and said, what would be ideal? And they said, if we could just have a private ward so his friends could be with him at the end. I think the main problems is a question of changing attitudes. I think it's happening, and that's why I'm very happy to be involved with the Transforming Cancer and End-of-Life Care, and they're prepared to listen and see what the problems are. And so I'm very happy to go along with that. I was diagnosed with HIV in 1984, and at that time there was no treatment and there was no support. So you were very much on your own. And I thought I was going to die. I just really did. And I was so glad when I found that I was asymptomatic. And for 10 years I was able to enjoy my career in professional theatre, which I loved. But in 1994, I was diagnosed with an AIDS diagnosis and given 6 months to live. And at that time, the perceived wisdom was that if you got an AIDS diagnosis, you'd last a year, 2 at the most. When you're faced with death, it changes your perspective. You alter the way you see things. You realise what's important. The biggest problem is probably the lack of coordination between the different services. And it's all a question of involving people and involving families and friends in decision making. It's not a top-down thing. It's no longer the physician, the doctor that dictates everything. You've got to put the patient at the centre of things. I think it's a difficult concept to come across, but the idea of having integrated care that I wholeheartedly support, then it means that the money is and the care is going to the patient, and it's the patient which should be the focus.